The Kenneth C. Griffin Esophageal Center was really created to bring together world experts on the esophagus. We focus not just on the clinical practice of esophagology, but also do the cutting-edge research that leads to the algorithms that help us manage these particular patients. The center is really positioned as an international center of excellence in terms of clinical care. People come from all over the world to watch us do procedures, see how we analyze the diagnostics, and then come up with a care plan. So by training all of these international scholars over the years, we've really attained a reputation of taking care of the most complex patients. So the one nice thing about Northwestern and our esophageal center in particular is that we have all the technologies. We're able to integrate these tools that may be somewhat mundane to other people, but the way we use them together makes it much more accurate in terms of getting to the root cause of the problem. And one of the things that we've been able to do is create new technologies and new devices that can actually help us better understand how the esophagus works. And that's crucial to helping us take care of patients. One of the primary focuses of the Kenneth C. Griffin Esophageal Center is using and implementing machine learning and AI in terms of improving diagnostics. We study the physiology and the biomechanics of the esophagus using these machine learning techniques, and then we're able to apply these to diagnostics that are used all day in the esophagus. The ultimate goal is to really replace the diagnostician like me with AI tools so that we can generalize expertise across the world. We're innovators in the Griffin Center, and we like to look at technologies that are already existing and make them better. So we were recently awarded a patent called 4-dimensional high-resolution manometry. So right now, the gold standard for assessing people with esophageal problems like swallowing and reflux and looking at the motor function of the esophagus is manometry. The problem with that is it only looks at pressure. Now, we've actually brought in measurements of volume, so we can actually look at the pressure-volume relationship as it pertains to how the fluid moves down the esophagus and how the muscles are pushing it through the esophagus. And we really believe that this is going to have a major impact in our ability to accurately define disease states. The other technology that we were recently awarded a patent for is called endoscopic manometry, where we're actually able to do manometry while the patient is sleeping, very similar to the FLIP procedure. So the patient can actually get an accurate diagnosis without being awake and having to get a catheter thread down their nose into their stomach. It really is a team effort. Typically, patients with esophageal problems require a multidisciplinary approach. They need a lot of diagnostic tests, endoscopy. That's really where the GI doctor comes in. But then when we start to figure out how to treat the patient, the spectrum of what we can use can range from a behavioral medicine or psychologist all the way to a thoracic surgeon. So you really have to have a complex team to deal with complex problems. The other thing that really helps us is our interaction with our engineers. That has been a crucial part of our success in the center. We've been able to design new technologies, new devices. Many of the patents that we've come up with have really been through the integration with the McCormick School of Engineering and Northwestern Medicine. So we were fortunate enough to get the announcement of an award called PreMedia, which is Precision Medicine in Achalasia from the NIH, the NIDDK in specific, for $12 million. And this is a 5-year grant that's going to utilize 16 centers across the nation. Northwestern will be the primary site, where we're actually studying achalasia and esophageal motility disorders. We're going to actually test different types of treatments, different forms of the actual treatments, and then also study how patients perceive they do after the particular procedure. So we're looking at patient-reported outcome measures. And then on top of that, this gives us an amazing opportunity to collect blood and tissue, muscle tissue, so that we can explore what the causes are of this particular disease state.